Tonight, a 12 News I-Team exclusive. An employee at a Valley Mental Health Center is sounding the alarm that in the midst of this coronavirus outbreak, they are being sent into a war zone without proper protection. The I-Team's Bianca Bono joins us now with the details.
I get so anxious going to work every day.
Anxious because this Valleywise behavioral health employee is walking into a facility with a COVID-19 outbreak. As of August 3rd, at Valleywise's Phoenix Center, 12 patients have tested positive. At the Maryvale Center, 16. And while it's unclear how many are behavioral health patients at the Roosevelt campus, 62 cases there. 12 News visiting the Maryvale facility back in January. These Valleywise behavioral health centers are not built for social distancing, but for those experiencing a mental health crisis, ordered by a court to get an evaluation and help.
My job entails me to be right next to the patients, and sometimes 2 hours at a time, sometimes longer.
This employee, who asked to remain anonymous to protect her job, says in the past month, the outbreak has spread out of control to both patients and staff. She believes that's in part because she and her colleagues are not allowed to wear N95 masks while working, only surgical masks.
I was upset. All of my coworkers were upset. We would wear them and then we would get in trouble. We have to sneak them under surgical masks in order to protect ourselves.
Staff receiving this memo saying, quote, N95 masks are not approved to be worn in behavioral health settings, with no further explanation.
Why are you sending staff into the war zone, basically, without protection?
12 News taking that question and more to Dr. Michael White, Valleywise's Executive Vice President and Chief Medical Officer.
That surgical mask has been shown to decrease the risk of transmission of this virus.
White says it's a shortage problem. Hospital data shows Valleywise has enough N95 masks for the next 112 days. But that's just for medical staff working with the sickest COVID patients. For example, patients on ventilators. White says if that supply was extended to the behavioral health staff and others,
it would go from that 112 number to probably less than a week of supply on hand.
As White works to navigate these uncharted waters, employees believe a good place to start, work with the state health department to get more PPE that is medically necessary to slow the spread.
They need to step up and they need to protect our staff and our patients.
And Valleywise declined to tell us how many staff members are sick with the virus. When we reached out about the possibility of getting them more PPE, the governor's office referred us to the state, who then referred us to the county. We're in Phoenix. Bianca Bono, 12 News.